Hi everyone, and a very warm welcome to the first in the series of Understanding Menopause with the Menopause Counsellor. That's me, my name's Diane Danzebrink, this is Kevin, that's Piggy, there's a puppy in the background so there could be some noises, but I'm delighted to say that my first guest is the lovely Jane Lewis.
Hello, hi.
Jane is an author of Me and My Menopausal Vagina, and she's also a patient expert on vaginal atrophy. So Jane, could you just tell us a little bit about you?
Yeah.
And sort of what sort of brought you here, essentially?
So I've got three daughters, and life was going tickety-boo, and I had, on and off, I've had horses, and I used to ride, and I got to about 40, and sex was becoming just a little bit painful, but not enough to complain about. Okay. And then I carried on for the next sort of 5 years, and then almost overnight, I went from having lubrication in my pants and in the vulval vagina area to being bone dry. And when you're bone dry, you become sore and chapped.
Yeah.
And then I started having to, when I wanted to go riding out, I was getting sore and put some cream on. I then used to be, I used to go to the cinema and sit for a couple of hours. I used to wear tight jeans, all the things you do that you don't realise can become painful and sore when you don't have vulval vaginal problems, and all those things literally overnight I almost couldn't do.
So had you ever heard of vaginal atrophy?
No.
And were you in any way aware that you were perimenopausal?
No.
So none of those?
None of those.
Okay.
No.
So how did you, coming from a place where you didn't know you were menopausal,
Yeah.
And we know that vaginal atrophy is a menopausal symptom, coming from that place, how did you even go about starting to address what was going on for you?
Well, back then I didn't even, and I say back then, it's not that long ago, 7 years ago, I didn't have a computer, I wasn't interested in technology at all, my life was horses. And I was just starting to get quite bad-tempered, and I said to a horsey friend, something, and she said, well, you sound perimenopausal. Okay. I then decided that I would get on the computer, read about things, and realised that, oh, gosh, yes, because I didn't even really know about menopause. I just heard the odd headline now and then that HRT was being almost banned, the whole, that saga years ago. And women have hot flushes, a few periods stop, and that's it. Yep. Life carries on. And oh my goodness, no.
And so, like many of the female population,
yes,
none of us were taught anything about menopause.
No.
None of us understand anything about menopause.
No. Yeah.
So that's even more of a shock, isn't it?
Yes, yeah.
Okay.
Yeah.
So where did you start?
Well, I was getting sorer and sorer, and I thought, right, brave up, have a look. So I stood in the bathroom, got a mirror out and had a look, and I was like, gosh, now I haven't looked for 25 odd years because it's something we're never taught that we need to look. We check our breasts, but we're never told that we can actually, very rarely, but we can get vulvar cancer. And I had a look, and it was like, gosh, because I was as raw red as red tomatoes.
Right.
And very thin. The labia were literally like tissue paper. You could almost see through them. I can't remember what it looked like, but I'm pretty certain it didn't look like that.
Yeah.
And my pubic hair, I suddenly was in the mirror one day looking, and I realised that it was probably 75% gone.
Really?
It's just suddenly, I think... No,
you don't notice it.
You just don't notice it, no. And then, but also I had other things like my nose inside for a couple of years was permanently split and wouldn't heal. And then I had dry, sore eyes, I had an itchy ear. My mouth was so dry that I'd wake up in the morning with my tongue stuck to the roof of my mouth as if it was going to crack, and then very itchy shins especially.
Okay, so it's important to say here that estrogen, which is one of the 3 hormones that are changing during menopause, one of the main jobs of estrogen is it acts as one of the body's main lubricants. So what Jane's talking about there, the dryness in her nasal passages and the vaginal dryness, those symptoms are as a result of a lack of estrogen. So Jane, was it your GP first? Did you go elsewhere?
Yeah, no, so immediately I went to my GP, not my normal one, and he examined me and says, so I thought I'd got thrush because I'd never had thrush in my life.
Yeah.
Touch wood, still I never have. And he said, oh no, you've got something called leukoplasia. Don't worry.
Which is?
Leukoplasia is whitening, but I think it is what the older school term it as lichen sclerosis.
Which is?
A vulvar skin condition that is more common than ladies realise, especially in the menopausal years,
Right.
but also at the younger years when your estrogen is lower at both ends, although they don't say that this is the reason for it. It comes
Right.
under, they think, the autoimmune
Okay.
condition type
Okay.
thing.
So this is totally different
To
vaginal atrophy.
Yes,
Okay.
but very rarely lichen sclerosis can turn to vulvar cancer, roughly 5%. So it is something that does get ignored and does get mistreated and misdiagnosed and does need to be ruled out.
But very important
But very
to have
important
diagnosed.
To have diagnosed. And I was misdiagnosed at the beginning with it, and I was given the treatment for lichen sclerosis for 1 month, which is very, very potent steroid, and I was getting worse and worse because it's the worst treatment for vaginal atrophy because it actually thins skin that doesn't need thinning, which is when I then became, I'm afraid we don't like the term, but onto Dr. Google.
Okay, so how did you find some help?
I went to a gum clinic, which is a sexual health clinic, and because they are amazing, you can generally, well in my area, you can just turn up without an appointment.
Okay.
It's completely confidential, and that includes if you don't want your GP to know, you don't have to. They only contact you via text, and I've always had they were amazing, really kind, and they said, no, you don't have lichen sclerosis, definitely you have vaginal atrophy.
Okay.
And they diagnose it, and they do actually diagnose quite a few ladies with lichen sclerosis and vaginal atrophy because they look at vulvas day in, day out.
And what did they recommend for you?
Local estrogen to start off with, Vagifem internally, and a cream externally, because my problem is if you've had episiotomies especially, a lot of ladies' scars, like with any ageing process, scars become thinner. My episiotomies were on the verge of splitting open.
Okay, so you've obviously learned a huge amount
Yes.
about this,
Yeah.
and you've obviously really focused on this subject because
Yeah.
it's something that has affected your
Yes.
life.
Yeah.
You've obviously now gone on and written a book about it.
Yes.
So let's go right back to the beginning.
Mhm.
For anybody that's now sitting there thinking, hang on a minute,
Yes.
I think this might be me.
Yeah.
Can you talk to us about what vaginal atrophy actually is,
Yes. Yeah.
what the symptoms are, most importantly,
Yeah.
and what else is going on when that loss of estrogen
Yeah.
is happening?
Yeah. Well, so basically, when we're young or in our prime, our vagina is made up of something called rouget, and it's like a concertina, and then it's all supple and it opens when you give birth and have a baby and the penis in and all that out. But as we age, due to the lack of estrogen and collagen, those bumps start to go.
Yep.
So the whole area becomes flatter and thinner,
Yep.
and all the cells and the skin underneath and becomes much, much weaker and is more prone to tearing and bleeding. And the actual vaginal canal happens with what they call becomes shorter, so it shortens and becomes tighter.
Right.
Hence, some people use that awful term, use it or lose it. However, that isn't the best thing to tell someone whose episiotomies are about to split open. And sex for some ladies can get so painful that they actually bleed.
Yes.
And obviously, any form of bleeding, you have to always go to your GP.
Needs
But
investigation.
there are some GPs who immediately know that yes, this is an estrogen problem, and so many equally are. It's thrush, it's this, it's everything but. And if hormones affect us all our life so much, periods and having babies and our hormones, why doesn't anyone suddenly think when the hormones are being taken away from us at a rapid rate, there's got to be a knock-on effect?
Things are going to change.
Things are going to change.
Absolutely.
Yes.
So what would you say to anybody that's sort of thinking, do you know what, actually more and more I'm thinking this
Yes.
could be me.
Yeah.
What would be your advice about when they go and visit? Because the first port of call, I'm guessing, is going to be your GP.
Yeah, it should be your GP, but unfortunately people self-treat with all these products that are for sale, because everyone will assume most people assume they have thrush.
Yeah.
So they keep giving these thrush treatments, and then it becomes a vicious circle because the area is already sore and sensitive, and if you don't need thrush, and actually thrush is now becoming harder to treat because it's being treated when we don't have it, etc.,
Yeah.
etc. So if really the first time is if sex starts to get painful, you should go and see someone, because a lot of women, sex becomes painful and then they no longer have sex anymore, and they have no other problems. So in their mind, they don't have a problem.
Yep.
But then there are those that, and I say just because it is far bigger than just, but those who just have pain with sex, and then you get the next lot who have pain with sex. They have permanent soreness on the vulva and in the vestibule area. So the vestibule is sort of almost like no man's land. You've got the vagina, the vestibule, and then the vulva. That whole area in there, because it's like the inside of your mouth here, becomes so sensitive. So if you have burning, itching, splitting skin, you can even get ulcers, just thinning, all those things. You just don't self-treat. Go to your GP. And
repeated UTIs.
The bladder,
needing to run to the loo more often.
A lot, because there's an area of the bladder called the trigone area, which is nearer the front of the vagina and the urethra, that is very estrogen dependent. The same as because the whole pelvic floor is actually very estrogen dependent. But that is gets very sensitive because obviously estrogen keeps that whole area lubricated and more sliding and gliding, which doesn't allow bacteria to get in so much. But once you have start to age, the whole area dries out, which then allows bacteria to take hold, and UTIs become a very, very common problem for a lot of ladies, and that can be their so-called only symptom, which is constant repeated UTIs. That can be their vaginal atrophy. But if you're having constantly short doses of antibiotics, when actually some local estrogen could be what sorts it for you.
So essentially, if anything has changed, however minor that might be, go and get it checked.
Yeah, and have a look. Get used to looking.
Get the mirror out.
Get the mirror out and have a good old look. It might be a bit grim. Mine definitely is after all those big babies.
And it's probably a long time since anybody's looked.
Yeah, well, I mean, I think your husbands get used to what they see, don't they? I don't know, or your partners. But and I guess if they told us it looked grim, they'd be knocked around the head, wouldn't they? So we have. It is really important we start looking, because the older we get, the more chance we are of getting all sorts anyway, aren't we?
Absolutely. Yeah. So with everything that you now know, first of all, what's helped you?
So normally they say, a bit of local estrogen twice a week seems to be the cure-all for everyone. It really isn't for a lot of ladies, because they've changed the dosage to what it used to be.
Because it used to be higher, didn't it?
It used to be 25 micro milligrams per whatever. Twice a week, so that equaled 50, and then they did a survey of X amount of women, and some did fine on reducing it down to 10, so 20 equaling a week, and they decided to stick with that. However, there's a huge amount of women now, I don't know how long that trial was, who are having to go back to the equivalent of nearly 50 mcgs a week.
So the product you're talking about is Vagifem,
it's Vagifem,
isn't it?
But all the local estrogens, because there is something called the E-string, which is a round ring, and that releases the equivalent of nearly 5 Vagifem a week. So, and it is such a small dose. If you have 2 Vagifem a week, that's the equivalent to 1 HRT pill. So
for a year. For
a year.
Yeah.
So common sense tells you if you need 4 a week, that's 2. If you need, it's a 4. If you had to have it every day, that's probably the equivalent of 4 HRT pills a year. And I don't think the reason the women aren't being given it is because of they are so-called worried about the so-called risk. It's more than pounds and pence.
Okay.
Because it's regards cost. But
so what have you? We'll go on to all the different management.
Yeah.
But what have you found that's worked for you personally?
Yeah, so
what have you had to trial and error, if you like?
I've had to have HRT also, because although I was on the local estrogen, it simply wasn't enough.
So you have systemic HRT?
Yes,
okay.
Rubbing the thigh on the gel. And within 2 weeks of taking HRT, then my labia and the scars really started to plump up again.
So you noticed a difference really quite quickly.
However, mentally, my mind isn't a great fan of HRT, but I have to weigh up what vaginal atrophy, when it was at its worst, does. So I have to weigh it up.
Yeah.
So I take HRT. I use a very good moisturiser externally twice a day. I have to always, because if I don't, even with with the HRT and the local estrogen, I'm still really quite dry.
Okay.
And then I also use a very good quality vaginal moisturiser as well. And I have had to have laser treatment.
So you've had,
Everything.
you have a regime now
Yes.
that you use every day, and
Yes.
that's several things.
Yes.
And you've had laser treatment.
Yeah.
How many times have you had laser treatment?
So laser treatment definitely isn't for everyone, and too many people are getting it done. But I had come to the very end of the road. What led me to have it done in the end was my episiotomy scars were just literally. I was at the point of almost, if I turned on a chair, they'd have split open.
Right.
So I had to have 3 treatments internally, and then I had to have 5 externally. And what it has allowed to happen is the skin quality has gone back to being very, very good, very,
Right.
very supple, but it's allowing the local estrogen to now work.
Right.
Whereas before, it would irritate me.
Yeah.
Whereas now, it is whatever it is done. But it really isn't for everyone. And you have to make sure you get a very good gynecologist to talk it through, because it's not cheap.
And will you have to continue to have laser therapy?
Well, you're supposed to have a top-up every year to 18 months.
Right.
But when I saw my gynecologist a few weeks ago, she examined me, and because my skin has done so well with it, and it is allowing the local estrogen to do its work. At the moment, there is no sign that I need it doing again at the moment.
Okay, so it's very individual.
Yes, I think.
Okay,
yes.
so
Yeah.
can we talk through all the possible management?
Yes.
So
yeah.
if a woman is going to see her doctor,
Yes.
that she knows what all the various options
Yes.
are,
Yeah.
but then also the things that you can potentially buy over the counter,
Yeah.
because I know
Yes.
that you use a combination.
Yeah.
So what is it
Yeah.
that particularly for vaginal
Yes.
atrophy, what is it that a doctor can potentially prescribe?
So there are 4 items local estrogen that they can prescribe. One is called Vagifem, which is a little plastic applicator that a tiny little pill on the end. That's only for internal use. They can prescribe 2 creams for internal and external use. That is Ovaston and estriol cream. And then there is a ring which quite a lot of people don't know about, and that includes some doctors, which is a silicone ring. It's about so round. It sits high up in the vagina, and it sits there for 90 days, and it releases a small amount of estrogen 24/7, roughly the equivalent to 5 doses of local estrogen a week, because some ladies are allergic to the fillers in the other 3 products.
Right.
And the E-string can be a way of helping to plump up the vagina with less fillers, and you can either carry on having it or using it, or it allows you to then perhaps a year down the line go on to other ones.
Yeah.
I did use it for a year and it was very good, but it still wasn't enough for me.
Okay. And it's important to say that for lots of ladies, I certainly speak to lots of ladies who say, I can't have HRT. And the amount of people who really can't have HRT is actually very minimal. But for women who absolutely can't have HRT, some of those women can still have these local estrogens,
Yes.
can't they? Because,
Yes.
as Jane said, they are such very low doses. So could we talk about now the contentious sometimes subject of lubricants and moisturizers?
Yeah.
Because there is such a confusing array out
Yes.
there. Could we talk about some of them? What to look for?
Yes.
I'm not talking about brand names,
No,
but what to
no.
look for and what to avoid.
Well, ultimately, you want to have the one with the least ingredients in. If possible, organic. Not everything is, there aren't that many out there, but you want to go as with the least amount of ingredients in it. And there are so many different products on the shelves, and unfortunately the problem is with vaginal products, they do not have to list every ingredient on the packet.
It's interesting to know.
Yes,
Yep.
yeah. The ones I use, I hopefully trust. I trust that they are doing what they
Yep.
say. It's, a lot of it's to do with something called osmosity, and some of the products that are for sale on the shelves, because the idea is you're trying to put moisture into the vagina, but a lot of these products are actually doing the
Taking
taking
moisture out.
putting
Yep.
it out, and people don't realise that.
Yep, absolutely. So apart from, is there anything else apart from lubricants and moisturisers?
I think that is it. I mean, other things to try and make yourself more comfortable is you wear, white cotton underwear.
What about the women's health physios?
Oh yeah, so that is regards for vaginal atrophy, because a lot of people, women, when the pelvic floor is really affected with menopause, hence all these incontinence pads on the shelves. And it seems to be a bit of a joke that it's almost your rite of passage that we are sold them.
Yeah.
And although it's common to leak, potentially it's not normal. And I do believe, don't completely quote me on this, but roughly 65% of women can be cured from their incontinence if they go and see a women's health physiotherapist. I mean, it really is quite high. And if you start using incontinence pads at 50-ish, that could cost you a huge amount of money over the next however many years.
Yep.
But over time, it's going to make you very sore. So a women's health physiotherapist, you can get.
Can you see a women's health physio via your GP, or do you have to do that privately?
It's even if GPs know about them, they are available on the NHS. But I went privately because I need, choosing one that I wanted to see.
Okay.
But they can really help with the pelvic floor, because everyone assumes that if they are leaking pee, that their pelvic floor is too loose, and this just simply isn't the case.
True. Yeah.
Because if you hold your if you have to do this all day non-stop and hold this muscle really, really tight, it would become very tired, which would make you leak. Think of that as your pelvic floor, make you leak. And people do their pelvic floor exercises and they think they tighten, and then they stay tight. It is very, very important that you have to relax the pelvic floor, because how to do a pelvic floor exercise correctly is you actually start from the back passage, you go along the perineum, you pick up the vagina, pick up the urethra, go through the 3 layers, but you don't stay there. You've got to come all the way back down and relax it, otherwise you're going to it can come over tired and leak as well.
Yep.
So apparently, I think roughly 90% of women do not know how to do their pelvic floor exercises correctly. So if you go to a women's health physio, they can really help with that, and they can help with getting the blood flow back to the area also, because it's all about blood flow.
So potentially, for somebody that's struggling with this, potentially systemic HRT,
Yes, yeah,
certainly localised
Yeah.
HRT,
yeah,
could be
yeah,
lubricants and moisturisers
Yes, yeah.
of whatever
yeah.
type is suitable.
Yes.
And I guess it's partly about
Yeah,
finding
'cause
what's suitable
what
for
is
you.
one person's gold is another person's poison. I am very hypersensitive.
And then potentially referral to a women's health physio.
Yes, yeah.
This could be
Managed.
certainly managed.
Yes, it gives you the tools for life. I now see my women's health physio sort of. I go for a top up every 6 months, because I personally do not need to do pelvic floor exercises.
Yep.
Because I was so
Because you were a rider.
So I was a horse rider, and horse riders and gymnasts and that can have quite bad pelvic.
Yep.
They're very, very strong at the bottom but weaker higher. So as it stands, I go every 6 months to check what state my pelvic floor is in, and at the moment it's, I can jump on a trampoline with 500 mil in my bladder and cough and sneeze and not pee.
Okay.
Yeah.
What's been the, we don't really talk about vaginas very much.
No.
We don't talk vaginas, vulvas. No. We certainly don't talk vaginal atrophy.
No.
You've written the book.
Yes.
What has been the dogs are off? What has been the sort of response to the book and to you speaking publicly about this?
Well,
because it's a very personal,
it's a very
personal thing,
and it took a lot of courage on my half to come out and talk about it, but I'd simply had enough. But so far, I have had no meanness at all. I get a lot of emails, some of them are heartbreaking, but there's a couple I've had. I had one 2 weeks ago from an 85-year-old in America who had read it, and I do sometimes think, gosh, because it does push its limits with what is read about, and I think, gosh, what was an 85-year-old thinking when she was reading that? And she just said to me, you've brought me great comfort, and I'm now seeing my gynaecologist, and I'm comfortable for the first time in years.
Wow. And
then I heard the other day through the grapevine, a man had read it in his 40s, and he just wanted to understand about what women go through. And then his friend, who was older, was about to split up with his wife from years and years of marriage, and he said, read this book. And he was a bit of a geezer, and the guy said, I'm not reading it. They're married and not divorcing. She had vaginal problems.
Yeah, and I mean, sort of in my work, that's a lot of what I see.
Yes.
Are women and men who talk to me about relationship issues.
Yeah.
And we're talking about, sort of whether there are still physical relations, and very often there aren't. And when I then counsel, I very often find out that certainly vaginal symptoms are part of that.
Yeah.
So we have got some questions,
Doggo knocked it down.
which we now have to find on a mobile phone, because we were going to do this on the mobile phone and then the mobile phone was full. So we resorted to the iPad, and now we're going to find the questions on the phone so that I can ask Jane everything that has been asked of her. I think we've got about 20, so hopefully we're going to be able to cover something that sort of you're thinking. Obviously, if that's not the case, if we come up short essentially and we don't ask your question, then you'll be able to email me at menopausesupport.co.uk, or you can email Jane at mymenopausalvagina.com. Is that right?
.co.uk or .com.
Oh, there we go. .co.uk or .com.
Yeah.
So let's have a little look-see. Okay, so first question, Jane. What's the natural changes in the pubic and vagina area? Mine has changed dramatically and I wonder if that's normal.
Well, I mean, it's very normal to go the pubic hair. Some ladies lose it all completely. Some it just goes very thin and goes grey. No different to up here. The vulva area itself, the inner labia, can become very, very, very thin. It just everything loses its bounce. And you know, when we were younger, we had that bounce everywhere. What is happening externally is happening internally. And if it's not hurting you, then that is fine. But do be warned that we are living 30 or 40 years down, you know, without estrogen. Just be careful it doesn't get worse.
Okay. What symptoms show themselves, and at what point is it recommended that women get medical help? So I think we've probably talked quite a lot about the symptoms. At what point should women get help?
Well, I personally think it would be better to be proactive rather than reactive.
Okay. That sounds sensible to me. I would absolutely agree with that. Somebody's asked, can I take Vagifem indefinitely? So Vagifem is the product you were talking about. Yes. Can it be taken indefinitely?
Yes, because this problem isn't going to go away. And quite often ladies who stop using it because their GP thinks they can only do it for a while, or they're scared of using it, it then comes back with a vengeance. You don't stop watering your plants.
And this is an interesting second part to that question, bearing in mind what you said about the strength of the product and how it's reduced. Yes. I'm only on 2 pessaries a week. Should I try and go down to 1? So the answer to that is no. In fact, I'm guessing that some women have to go up rather than down. Okay. What's the best option without hormones? Well, I'm already using estrogen gel and would rather not use another estrogen product. So that goes back to what you said about the strength, really,
so
doesn't it?
I assume you're already taking, the systemic one, to add a tiny amount that I've just said, 2 a week, the equivalent to 1 extra dose of your gel is negligible. And, if you're a meat eater, your food's got hormones in. Your plastic, plastic. There's hormones everywhere.
And I think it's important to say that HRT has very small doses of hormone. Compared to the doses that are in something like the combined contraceptive pill, the doses in HRT are actually very small. Interesting question here from somebody who says, how can they approach their GP? I've tried, and I've been told just to have swabs taken when I know very well it's not thrush or bacterial vaginosis.
Well, then there's the NICE guidelines. You know more about all those things. So on the NICE guidelines, it's listed there. It is such a common, roughly between 50, but they actually think nearer 70 to 80% of all women are going to get this. I think we have to print everything off the internet, and we have to go. We have to almost demand. I know we can't demand anything, but if I had a GP that was refusing to give me what I know I need, I would almost write it down and get them to sign that they are refusing this because the treatment that I need. Yeah. So as Jane said, the NICE guidelines came out in November 2015. They were the first ever guidelines for menopause in the UK. It's actually not that weighty a tome. There is part of it that is designed for patients as well as doctors. So it's well worth having a flick through. You can find it just by putting NICE guidelines into the internet. You can download it, you can print it. You could even take it to your doctor and say, look, I understand if you don't
really know what to do with me or what to do with this, would you mind having a read, maybe consulting a colleague, and then we'll have a chat about it again. So it's about us really sort of starting to take some responsibility and actually stand up and say, we need this, we need you to have a look at this. And the more we do it, the more we're going to be helping other women to do the same. Okay, so can you talk a little bit about the vaginal ring? Well, you've done that. You said it's 90 days worth of treatment.
You can put it in yourself. Most people can put it in and out themselves, but if not, your GP can.
This is an interesting one. What's the best external skin wash?
Well, really, we're not... less is more. Most people really should just use water. There's all these things that you can buy because they're trying to get money out of us. We shouldn't smell of roses, but there are some products, especially the ladies that have got lichen sclerosis, they use something called Dermal 500, which can come from your GP or you can buy it from the chemist. It's not that much more expensive prescription-wise, but really just water and then a good quality moisturiser afterwards, like you would do your face. Okay.
Please ask if you have to avoid Kegel exercises if you have vaginal atrophy.
No, you don't have to avoid your Kegels at all, but as I said earlier on, you need to make sure you're doing them correctly. So if you are concerned about your pelvic floor, then I would, if you're going to treat yourself to something, rather than treating yourself to the latest makeup, I'd go and see a very good women's health physiotherapist.
Okay. Could you talk a little bit, it says here, could you talk a little bit about prolapse? Is it related?
Well, younger girls have prolapses as well from having their babies. But yes, as we age, because the whole area of the pelvic floor is very, very estrogen dependent. And as that estrogen reduces, everything, the collagen, everything starts to drop. Because our bowels change with hormones as well, how we digest our food and everything. So yes, they are more common in women as they age, especially if you had vaginal births, but cesareans as well. So yes, so for myself, I've had 3 9-pound babies. I'm just very conscious of how I don't pick anything up too heavy, and I make sure my breath is correctly. You don't when you pick up something, you don't hold it and tighten. But if you are thinking you have a prolapse, then women's health physiotherapists again can work wonders.
Be really helpful.
Really helpful.
Okay, and somebody's asking about something that isn't sort of from your doctor. Somebody's saying that they're trying sea buckthorn.
Yes.
Are they wasting their money?
I was on that trial.
Okay.
It's a lot of money, and there's try it. It didn't help me.
Okay.
But I do. It's good for potentially. It's good for the skin. I have an exceptionally good diet. I try and do everything. I was the last person in the world who wanted to take hormones. My vagina has dictated that it has to have them.
Yeah.
But there are ladies who say it does help. So if it does, you try it. Try it for 3 months.
Okay. That's a good tip. Try it for 3-month trial. Yeah, absolutely. Yeah. Okay, Jane, thank you. Before I let you go, I wanted to ask you, for anybody that's now got through 33 minutes of us talking about vaginas and vaginal atrophy and everything that's associated, and is now thinking, actually, I think this is something that I need to address. Yeah. What would be your top tips for anybody watching this now?
To not cower in the corner and be shy. Go and see your GP. Don't self-treat. And if you get a GP because I hear of ladies who some of the men say, "Oh, I don't examine women."
Yeah, I've heard that too.
And you say, "Well, I want examining," and if you are turned away, you have to take it high. It goes to the practice manager. I did talk to someone recently quite high up in menopause world, and that person said, unless we as the patients start complaining,
advocating for ourselves,
and the more we keep going privately because we are so desperate, the less chance that we are going to get help through the NHS. So it's a vicious circle. But I appreciate that when you are so down, it is really hard as well. But take someone with you, write it down. If you're really shy, when I was at my worst, I was in a really bad state. I wrote everything down and just handed it over to my GP.
Yeah. And, I often say to women, take notes, take somebody with you so that you feel that you're sort of safety in numbers, that you're not going to forget, sort of everything that you want to say. Yeah. Okay. What about from the longer term? So you're sort of, when we're talking about women in postmenopause, and older ladies.
Yes, yeah.
So, you know, sort of, I know that you're aware, and certainly we've had the discussions about the older women in the community who have been let down, who are now potentially sitting either at home or in nursing homes, who have not had the right advice and support and are struggling.
So I've spoken to a couple of GPs, a gynaecologist, and 2 people who work in nursing care homes, and it seems that, you know, there will always be exceptions, but women are neglected in the vaginal, vulval, bladder area. And it is my biggest fear for myself, which is why one of the reasons I came out and trying to make a bit of a noise. But what happened, a gynaecologist I spoke to said the problem is the women are getting it into the nursing home because they haven't had the correct treatment or have refused to use the correct treatment because they're so scared of local estrogen before they get there. Once you get to a regime that's working for you, and even if that's at 45 and you think, I can't do this forever, yes, you can if you need it, if your vagina needs it. So once you get a regime, don't try and reduce things. Stick with it. If it ain't broke, don't try and fix it. Just keep going with it. And as you age, you might need more, then so be it.
And that's really, really good advice. That's really part of the reason why what Jane was talking about there, about advice and support, getting the right advice at the right time, is really the reason why I started the hashtag Make Menopause Matter campaign. If you haven't signed the petition yet and you would like to see better education, better support, better awareness for all women, because it doesn't just affect women, it affects relationships,
Family, everything.
the family, the workplace, etc., etc. Then you can find that petition by going to menopausesupport.co.uk. As I say, if you've got a question that Jane and I have not got round to, then you can certainly contact me that way. You can contact Jane, mymenopauseofvagina.co.uk or .com. Jane, just finally to say, thank you so much for your time. Very much appreciated. Thank you for watching, and I will certainly be back with more of these to come. So if there's anything that you would like to see about menopause, if there's a particular subject that you would like to see covered, do either pop a note under this video or drop me an email, and I'll make sure at some point that we cover that too. So thank you for watching, and it's been great to have you here, Jane. And thank you. So I'll see you again soon.
Thank you. Bye.